But last night, Trump seemed to break with his health secretary's anti-vaccine rhetoric.
Look, you have vaccines that work. They just pure and simple work. They're not controversial at all. And I think those vaccines should be used. Otherwise, some people are going to catch it and they endanger other people. And when you don't have controversy at all, I think people should take it.
At Thursday's Senate hearing, some of Trump's fellow Republicans joined Democrats in grilling Kennedy on his extreme vaccine positions and promotion of public health misinformation.
I want to go back to just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
The Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant?
You also told Senator Wyden at the outset that you didn't want to take vaccines away from people. I would say effectively we're denying people vaccine.
So let me ask you, when were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
Joining us now, Dr. Paul Offit, director of the Vaccine Education Center at the Children's Hospital of Philadelphia. He was recently removed from participating in a vaccine advisory committee for the U.S. Food and Drug Administration. Dr. Offit, thanks so much for joining us this morning. Can we get your take on the grilling of RFK, especially by Republicans, and what you think this means for his future in this job and for public health for all Americans?
I think it was encouraging. I know that some of those senators had seen polling from actually a Trump-friendly polling group showing that most American parents want vaccines. Most American parents find vaccines to be safe and effective, including Republican parents. And I think that may have influenced people like Senators Cassidy, Senator Barrasso, Senator Tillis, who took up the mantle of challenging RFK Jr. for his false beliefs. So I take heart in that.
You know, one of the things that, as we were talking about this segment, the team, is the schedule, right? So COVID, for example, there seems to be, and he talked about this a little bit in the hearing, confusion on whether or not people can actually get the vaccine, right? There was this guidance that came out from the CDC that was like 65 and older, and when you're really young, that means that insurance company, you tell me if I'm wrong, that insurance companies are going to look at that guidance, take that guidance, and pay for it or not. Pharmacies will or not give people the vaccine for free. And the confusion over this seems like the biggest problem that you could possibly have. We should all understand when and how we can get vaccines in this country. It's 2025.
Right. I think confusion is the point. I think that's Robert F. Kennedy Jr.'s goal, is to make it confusing. And I just had a series of emails this morning from parents and others saying, I'm having trouble getting vaccines. I mean, there are pregnant women who have emailed me and saying, I can't get a vaccine when pregnancy is clearly a high-risk condition for severe COVID. And I think he has made this very hard. I really wonder whether RFK Jr. understands what's going on the ground. I'm not so sure he does.
Yeah.
And I just want to play a soundbite from Senator John Barrasso, a Republican who is also a doctor who spoke out against RFK on Thursday.
I support vaccines. I'm a doctor. Vaccines work. Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned. The public has seen measles outbreaks, leadership at the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired. Americans don't know who to rely on.
He makes a really good point there. Who should Americans be relying on, Dr. Offit?
Well, you can't rely on the Advisory Committee for Immunization Practices anymore. RFK Jr. fired all 17 members, claiming falsely that they were in the pocket of industry, even though they clearly had the kind of expertise and experience that we needed, and none of them were in the pocket of industry, and replaced them with 7 people who don't nearly have that expertise. And so all the medical and scientific organizations I know no longer trust the ACIP, and by extension, no longer trust the CDC. So now we're looking towards these consortiums, like in the Northeast, and in the West, of states that are providing information, trying to make sure that insurance companies will cover vaccines that should be recommended, although some may not be, like, for example, the COVID vaccine for pregnant women. So I think that's what's happening. The American Academy of Pediatrics now has its statements about what vaccines children should get. And I think people are now looking to those other organizations. But I think it's a tough time.
You know, Doctor, while you talk about folks looking to these other organizations to figure out what they should do, you have these, you know, I guess democratic states kind of banding together and say, this is how we're going to operate. The CDC was the gold standard of all of this, right? The gold standard for the whole world, really, right?
President Trump and his aides are praising Health and Human Services Secretary Robert F. Kennedy Jr. on his combative testimony this week. Republican and Democrats both sparred with Kennedy over ongoing chaos in the department and messaging on vaccines.
Let me ask you, when were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
Oh, so more denial, more back and forth.
Do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
Let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
that was a statement.
I did not say that.
I would say effectively we're denying people vaccine.
Senator Cantwell.
You're wrong.
Now, that testimony left a lot of health officials stunned, including Dr. Dimitri Daskalakis. He resigned last week from his job as the director of the CDC's National Center for Immunization and Respiratory Diseases. And Dr. Daskalakis joins me now. Thank you for joining me this morning. Let me play for you the reaction and the vote of confidence from President Trump after that testimony.
Well, I didn't get to watch the hearings today, but he's a very good person. And he means very well, and he's got some little different ideas. I guarantee a lot of the people at this table like RFK Jr., and I do. But he's got a different take, and we want to listen to all of those takes. But I heard he did very well today.
So the president says he's got a little different take, but he means well. What would you tell the president about the secretary's leadership?
I mean, I think that his record stands for itself, and the road to hell is paved with good intentions. So I think that maybe he has the intent to do something good, but it sure seems as if the strategy that he's using is one that's going to compromise the health of Americans.
Let me ask you also about what the Wall Street Journal reporting is that HHS will soon release this report that connects the use of Tylenol during pregnancy to autism. What's your reaction to that pending report?
First, I'll start as a public health professional. I really wish HHS would stop doing public health via soundbite or through leaks. I think if they have something to share, they should share it. So the very first reaction is, they're going to make an assertion, but what data are they going to show to back it up? The American College of Obstetrics and Gynecology, they've been very clear in a recent statement that Tylenol is safe to take during pregnancy. There's meta-analyses that demonstrate there may be an association, but no causal link. So it's like, I have matches in my pocket and I have lung cancer. The matches caused the cancer? No, it was the smoking that caused the cancer. So I don't know what the report's going to say because everything is being done through leaks and through sound bites. I think once the report comes out, it needs to be reviewed by peers. It needs to be gold standard science. It needs to be something that's reproducible. So he's going to say gold standard, but show me the money. Where's the gold standard science if it's not really backed by good evidence that is transparent and available? So we'll see what happens.
I wonder, what should pregnant women do considering what we've heard from the secretary in the past, these debunked theories about vaccinations causing autism and some of the claims of, diabetes in China that are just aren't credible. How should they accept this report?
Well, so first I want to say that this leak or soundbite public health is designed to distract from the fact that Secretary Kennedy is trying to dismantle vaccines and take them away from people. So I'll start by that. Bottom line is that anyone who's pregnant, they really need to be engaged in prenatal care. Talk to your OBGYN. Like I said, the American College of Obstetrics and Gynecology has already put out a statement saying that Tylenol is something that could be used during pregnancy and that it's safe when it's used in a responsible way. So talk to your doctor. Secretary Kennedy said not to trust him for medical advice. Don't trust him for medical advice. When the data comes out or when the statement comes out about this, when whatever this report is, the next question is, look at the references, look at the data, talk to your OBGYN. I've seen the things that are coming out of HHS where an assertion is made and then the data is not there, or even better, the data is mischaracterized. So, this is the time for gold standard science. People need to review the data.
On immunizations, Florida, the Surgeon General, I'm sure you know, announced that Florida is going to end its vaccine mandate, including for children who want to attend public schools. The president came out with his strongest endorsement yet of some vaccinations. Let's watch that.
Look, you have vaccines that work. They just pure and simple work. They're not controversial at all. And I think those vaccines should be used. Otherwise, some people are going to catch it and they endanger other people. And when you don't have controversy at all, I think people should take it.
So what do you make of what you heard there? And it's interesting, the president said when you don't have controversy at all, people should take it. The endorsement and the growing skepticism of vaccines among some.
Yeah, I think that that the way to address controversy is to talk to your doctor.
I think Trump realizes he's making a mistake. Now, will he actually fix it? God knows, right? And certainly he's not going to take any accountability. But I think he realizes the Frankenstein, he created, right? And helped build. And Donald's realizing they'll turn on him eventually too, right? In some cases because he deserves it, but in other cases, they turn on him for the brief glimpses of a normal human that Trump is about one day every 300, 400, right? On days where Trump is like, actually, this thing that's been backed by hundreds of years of science now, right? At least a couple hundred years of science in some basic sense, is actually good. That you can inoculate for illnesses, and that makes it more likely that you'll survive and be healthy, and they work. Generally, right? Like, and him saying that is creating a massive MAGA civil war. And so this is him. This is about as close as Trump is going to get to admitting he effed up. Now, the only way he can fix this is by firing RFK, right? He has to fire him, right? Like, he has to. One, there's a fundamental disagreement on basic science, apparently, between Trump and RFK. And while there can be disagreements between a president and their cabinet members, and there probably should be disagreements between a president and their cabinet members, often those disagreements don't go to a fundamental philosophical difference. And two, those disagreements often have to happen in private. The way it works in Canada is that when you serve in cabinet, you're not supposed to criticize the prime minister. Right? If you're in the same party as the prime minister, but you're not in cabinet, sometimes criticism is tolerated. But if you're in cabinet, you're sitting there under the belief that while you can tell the prime minister he's a dumbass behind closed doors, and that you think his dumbass policy is going to make the country worse or hurt the party in the polls or whatever, once the decision is made, you either back the prime minister or you get the heck out of cabinet and you resign from cabinet, or you get fired from it. And so Trump needs to get rid of RFK. Because right now he's basically saying, I screwed up picking this guy. Now he actually has to make amends. I don't think he's going to do it, though, unless he's forced.